If you've ever considered orthopedic surgery, chances are a number of questions came to mind. You're not alone. The Allegiance orthopedic surgeons understand and want you to have the information you need. In this video, they'll respond to your most common questions about joint procedures. How do I know the difference between arthritis and carpal tunnel?
As a physician, I'm often asked that question, specifically as a hand surgeon. How do I know when it's just arthritis, as people often phrase it, for one reason or another, or carpal tunnel? Really, most things we see are fundamentally very different. Carpal tunnel is primarily numbness and tingling. Usually it happens when you're around 40. You start to wake up in the middle of the night with your thumb and index and maybe your whole hand falling asleep. Arthritis usually happens around the same time, especially in women, often at the base of the thumb or in the finger joints, and usually that's with use in certain activities, whereas carpal tunnel tends to be at first more at night, with driving, doing your hair, things like that. So really history and just a short conversation is everything that it's about. Usually physical exam and studies and all those things don't point me in the direction of the diagnosis, but just a short conversation.
You say I don't need an MRI. Why is that?
A lot of patients come in requesting to get MRIs for various knee and shoulder issues. An MRI is just one of the many tools that we use to aid us in our diagnosis. And typically it's not the first tool we use. The history, talking to the patient and learning what their problem is, getting the story from the patient, how they got injured, what makes the problem worse, what makes it better, how long has it been there. All these questions are the primary way we learn about what's going on with a shoulder or a knee. And some studies show you can diagnose up to 95% of the problem just by talking to the patient without even doing any further physical exam or further studies. Physical exam is the second part of the evaluation, where you actually touch the patient and you see what makes things worse and makes it better. And then after that, there might be an x-ray, and then if we felt we needed an MRI down the road, that might be something that we would do. We often, especially in terms of the shoulder, we often do physical therapy. We might try an injection, some conservative care, and a lot of patients get better with that before we even consider further imaging.
How long do I have to stay in the hospital?
To answer this question, it really depends on whether or not you've had a hip or a knee replacement. Over 90% of our patients that have a first-time hip or knee replacement are able to go home within the first 1 or 2 days. However, there's about 10% of patients who have partial knees or anterior hip replacements, these minimally invasive surgeries, that allow them to go home within 24 hours.
How soon before I can walk again after my surgery?
A lot of times patients ask me that question, and it's an excellent question because having surgery of the foot and ankle is a big deal, and a lot of times I have to have my patients stay off of their foot for a prolonged period of time. And if it's your right foot, it makes it hard to drive. So it depends on each type of surgery which I do. It can vary from a few days to as much as 6 weeks. So it's a good question to ask when you come to see me.
For more information or to schedule a personal consultation with a surgeon, call Allegiance Orthopaedics at 517-841-1431, Monday through Friday from 8 a.m. to 5 p.m.